Thank you very much for the very kind introduction. My name is Jay, and I'm a consultant urologist with Pan Asia. So good afternoon, and thank you very much for spending time. I'm sure you guys are looking forward to a very, very exciting talk. And for me, it's also very exciting and very stressful because guess what? My mother is here to have a look at, watch me do my job. So what we're going to talk about is really incontinence. Incontinence is basically known as many things. It's leakage of urine, or 橡酒, people say, or 漏尿, or 尿失禁. And so basically, what happens is a lot of, as we age, a lot of people will have some of these problems. And most importantly, many people don't seek help for it because they think that it's actually normal. And the most common things that I hear is, oh, it's part of growing old. Everybody has it. When I went downstairs to talk to my friends, so I always thought it's normal. That's not necessarily true. So today we are here to talk about understanding why you have incontinence and how can we actually say good riddance to a symptom that has maybe troubling you for a longest time. What exactly is incontinence? So we will be talking a few things today, and the first things that we would like to talk about is a definition. If you're all doctors, they will tell you we have lots of definition, and definition is important because from there you may be able to find out what are the causes that you have and why does it matter to you. And basically, once we figure out what kind of incontinence we have, we will go into a bit about diagnosis and how do you actually go around treating it. This is a picture of the urinary sphincter, and on the top we have a male, and on the bottom we have a female. The men and the women are built differently. The key differences is that a sphincter is basically what we have to keep the urine inside, kind of like a door. For men, we are a bit more fortunate. We actually got two doors. For ladies, unfortunately, they only got one door. That is why ladies tend to have a bit more problems when it comes to incontinence, especially if you had given birth before, or you basically had lots of children, or you're slightly on the obese side of things. So let's start by understanding what exactly is the definition of incontinence. Do I have it? Incontinence, according to the International Continence Society, is defined as the complaint of involuntary loss of urine. So involuntary being the keyword, loss of urine being the keywords. And for men and women, the numbers are quite staggering. What do I mean? For women, it is actually very common. And it's most common, the first time you probably would have gotten basically exposed to it is if you were to have urinary tract infection when in your teenage years. After that, it is usually comes about in pregnancy. Up to 30% of ladies experience some form of incontinence during pregnancy. But for the purpose of today's talk, I will not be talking about pregnancy incontinence because after all, it is a temporary thing. It's because you are having a baby. What I'm more interested in is incontinence in the other population. And you can see here, if you look at above 20 years, up to 10, minimum 10% of the population, that is 1 in 10, and can be as high as 6 in 10 ladies above the age of 20 suffer from some form of urine leakage. As you age even more, above the age of 60, you're talking about half, meaning to say 1 in 2 of you would have some form of urine leakage. That's quite a fair bit, all right? Like you said, millions of people. Only 1/4 at best seek help. And that's different on different locality. All right, not everybody seek help for it, and you can imagine people are suffering. And I'll tell you a few examples of what stories I normally hear about incontinence and how it affected them. And a lot of it for the ladies is because the pelvic floor support is not as good as it used to be, and that's generally the reason for ladies having a bit of a leaking urine. Now for men, our structures are different below, and we are a bit more fortunate in that our numbers naturally are a lot lower. If you look at the 20 to 42-year-old, we are looking at only 5%, which is a lot less than, say, 60% or 10%. As we age, about 20% of us would have some form of urinary incontinence by the age of 65. So still 1 in 5. But the problem with men is even less men seek help, meaning to say only 20% would actually come to me to ask about why am I leaking urine, meaning to say there's 8 out of every 10 person out there who's leaking urine right now and basically don't want to seek help. So just in case everybody's wondering, later on when you have questions for me, I will assume you're asking for a friend, don't worry, okay? So what types of urinary incontinence do you have? Men and women have different causes of urinary incontinence. And for ladies, a lot of the time, I told you, because of the pelvic muscle, it's a bit weaker in the ladies. They have a lot of stress or urge incontinence. Stress incontinence is basically what we commonly know when you sneeze or when you cough, or when you carry heavy things, or even when you sit up to stand or stand to sit, you might experience 1 or 2 drops of urine. And this can happen very commonly for ladies, and that's what we call stress. Or anywhere whereby you have to strain your abdominal core muscles, or you kick a bit, that's what we always call, right? Then you have a bit of leakage, and that's usually stress urinary incontinence. Urge urinary incontinence is also very common in ladies. That's when you have a sudden, out of nowhere urge to rush to the toilet. And a lot of times, you may or may not get there in time and you have a bit of a leak. And this can be quite debilitating, because I have heard many ladies come to me and say, I don't go out, or I only go to certain places. Why? They must know where the toilets are, and they know every single little location of the toilets that we have. And it happens to my own family member. The other mother that I have, not this one, basically goes around and says she doesn't want to go because she goes to Bukit Panjang Plaza. She knows exactly which one is the toilets down there. That one is open, that one is closed. Level 3 don't have female toilet. Of course, I never brought her overseas before because she refuses to. Okay, and she does. Nowadays she can. She wants diapers. Okay, and you don't want that. For men, different thing. Men is usually because we've got prostate. Okay, with prostate, as we grow older, they get bigger and bigger. And when they get bigger and bigger, they block the door. When you block the door, the bladder, you actually cannot pee properly, or you pee very, very slowly. And so the bladder holds and holds and holds. And basically, when it cannot hold any more longer, it actually leaks. The dam broke a bit. It's too full. They pass urine only because it overflows. That's called overflow incontinence. It's not passing urine, it's because it's too full. Okay? Very different from the cause for the ladies, and it's very important because we treat it differently. If you were to be unfortunate enough to have prostate cancer and you need to have surgery, the surgery itself causes a lot of problem, and it destroys one of the 2 sphincters we have, leading to a lot of incontinence problem. That can be a big cause. Treatment, again, is very, very different. You can obviously have mixed. Mixed is when you have urge plus stress incontinence. These are the ones that's a bit more difficult to figure out. And it takes a lot of time on my end to sit down with you to figure out which one of these affects you more. And we have functional. The functional one, basically, it's a bit of a new way of classifying things. Functional urinary incontinence comes in primarily because of temporary issues that we have. For example, we broke a leg, or we can't walk because we need a tongkat to help us there. We can't get there in time. And because of that, we leak a bit of urine, but it's because of the fact that we can't get to the toilet rather than the fact that our bladder has something wrong with it. And there are many reasons, and it can be temporary. For example, you're having a bit of a cast, or it can be permanent if, let's say, you are bed-bound permanently. So the ladies' causes, as I said to you, let's go a bit more into exact causes. Stress urinary incontinence, I say, is the most common type that I see. Essentially, what happens is a lot of times ladies who have lots of kids, in the older generation, probably the 80s and 90s, when I started out about 10 years ago, I still see a lot of 90-year-old ladies around. They have 10, 11, 12 kids in a kampong and things like that. These ladies have a lot of problem because pregnancy puts a lot of strain on the pelvic floor. And over the years, while they were young, they could actually still keep everything intact, or rather keep everything inside. But as you age, and because of the fact that they have lots of pregnancy before, then as you age, 80, 90, all the muscles loses its tone, everything starts coming out. The number of children definitely has a direct link. How they gave birth in the olden days normally is all through vaginal delivery. Very people don't have C-section. Very little people have C-section. And if you were to do vaginal delivery or you had assisted delivery but you have forceps, the chances of you having stress urinary incontinence is higher also. If you are also not the thinnest person around, all this adds on to the weight that your pelvic needs to support. And that's some of the most common cause. In terms of urge the one is basically you have a sudden risk that you must chiong toilet. That kind you cannot wait. Those are a bit different. Majority of the causes is caused by the fact that you have an overactive bladder. As the name suggests, what overactive bladder simply means is that the bladder squeezes when it's not supposed to. Everybody's bladder capacity for ladies around 300 mils of urine before you must go to the toilet. For men, it's around 400 plus. So before you reach 300 or 400, like maybe 100, they start squeezing and basically tell you to go to the toilet. A lot of times it's because of the food and the drinks that we drink, which is caffeine is one of them. I will go through them in a bit later. These urge and the urinary incontinence are characterized. Many times they come to me and say, I must go to the toilet very frequently. If not, I will leak. Or I wake up many times at night to go to the toilet. If not, I will wet my bed. Okay, these are some of the symptoms that is commonly said to me, and if there is, you experience some of this, or rather your friends experience some of this, it might be a cause, okay? Mixed, you can have both, and that essentially means that every single other thing that's here possibly can have. If you're menopausal, you can also begin to have a bit of incontinence as well because everything gets a bit more atonic as we age. Overflow incontinence is generally due to big prostate or what we call bladder outlet obstruction. And finally, functional urinary incontinence is the causes is basically as per what I said. You can't get to the toilet and there's actually nothing wrong with your bladder. For men, we also have a whole set of this kind of problem. For men, the causes are very different because we don't have pregnancy. We don't have to worry about pelvic floor muscles weakening as a result of having to go through pregnancy. And for that, that's why we have Mother's Day. You don't have Father's Day. That's so important, okay? Now, stress, if you do have, is primarily because your prostate is very big and your bladder is almost always full. In this situation, some guys also tell me, cough, sneeze, hairy, heavy things, you have a bit of a leak because their bladder is 1 to 2 liters full and they have no idea. Other causes could be urge urinary incontinence for them. For the men, usually it's because there's a bit of a neurological cause to it. Neurological, we mean by having previous strokes before, have Parkinson's disease, they have urinary tract infection. These are some of the problems that can affect the wiring or the neurology of the bladder, therefore causing the bladder to squeeze unnecessarily. If you have a prostate, big bladder, the most common cause for men, however, is actually overflow incontinence. That's when the bladder is big, and I've gone through that already. And of course, you can also have functional for men. And particularly the last line is incontinence for prostate treatment. If you have prostate cancer, only men has prostate. Only man needs to go for a prostate surgery. And if you destroy that's one of the two sphincter, you can potentially have a lot of problem controlling your urine. And this is a unique one that's only applicable to men in this case. Some of the signs and symptoms, I've gone through a lot of the different types. Some of the things that you may experience, for example, in stress, coughing, sneezing, heavy lifting, exercises, and mainly in the ladies. If you have urge incontinence, it's the sudden, unstoppable urge to leak. And if you don't go to the toilet, you may or may not have incontinence as well. If you have previous strokes, if you have previous neurological issues, then you are more likely to have urge urinary incontinence. And this is also accompanied by the fact that you must go to the toilet very frequently at night or even during the day, what we call frequency. For men, if you are a man and you have a lot of problems going to the toilet, you feel that every time after you go to the toilet, it's like you never really clear everything. That's what we call incomplete emptying. And you have lots of urinary tract infection problem. And men don't actually normally have urinary tract infection problem, and you're going to the toilet very, very poor flow. You cannot shoot as strong as you would like to. Usually that's a sign that you might be having overflow incontinence. Of course, mixed, then you basically have mix of everything. You can have sneezing, and then you can have sudden urge. Wheelchair bound, cannot walk, those are functional, and of course the last one being prostate cancer surgery. I've gone through a lot as to why incontinence can happen, how it can happen, how you recognize. Does it matter? Does it bother you? A lot of you will probably tell me no, because all of you somehow are ambulant, what we call can walk, can go shopping, and that's why you're here. But there are a lot of people who are at home right now and have a lot of problem dealing with it. And also, for people who may not know, but it matters because if you are constantly leaking urine, you can imagine it's almost always wet at the private regions. That whole area is very damp, it's very dark. You have diabetes, let's say. It's a wonderful place for bugs to grow, and you always have a lot of infection. And the infection leads to a lot of problems like kidney infection or even whole multi-organ failure. If you have incontinence, you are almost always going to have a poorer outcome than someone who don't. And the evidence in the medical literature is very clear. If you're looking at the nursing home population, the number of death rate is higher than the general population, 30%. So more people die if you have incontinence, okay? And the reason for that is because you got more problems with bed sores, problems with antibiotics, infection, and things like that. Does it matter? Of course, I've talked to you that they don't dare to go out. And if you basically stay at home for a long period of time, you go crazy. A lot of them do go into depression, okay? And for ladies that are not pregnant, if you have incontinence baseline, you will have a lot of sexual dysfunction. What do I mean? About 30% of people with incontinence would definitely have incontinence during sexual intercourse, 30%. So 70%, you'll be fine, 30% might have a little leak, and that basically can cause a lot of problems when it comes to marital bliss, okay? And of course, healthcare costs is increased. You got more infection, you see people more, you see doctor more, you come to me more expensive. No good. Let's talk about more concrete stuff. Another reason why it matters is because people wake up at night, go to the toilet. Okay, let's face it, we are Asians here. We generally don't like to bother our family members when you wake up in the middle of the night. A lot of us just wake up in the middle of the night, we don't turn on the lights because we don't want to disturb our partner. So we start feeling around in the dark. If we are lucky, we get to the toilet, no problem. We are not lucky, you trip on something, you fall down. If you're on blood thinners like Dr. Tan, he's no longer around. Blood thinners, you crack your head, you bleed a lot easier. Every night, people go 1, 2, 3, or even 4, 5 times. Every time you walk to the toilet, you are at the risk of falling down, hitting your head. So nocturia does cause death. And in this Canadian article, it's very clear. 1/3 of the people who fall at night is because they went to the toilet. And if you're on blood thinning medication, the risk is down there. You crack your head, it's going to bleed, you're going to have a stroke. And the outcome is obviously not very good. Even if you don't fall down, you get back to your bed properly, it disturbs the sleep cycle. 40% cannot go back to sleep, and you wake up feeling tired the next day. And it does cause a lot of problems in terms of quality of life and in terms of economic as well. So it's a very, very important problem that all healthcare departments all over the world want to solve. If you have overactive bladder, you don't get it sorted out. What happens is that the overactive bladder gets more and more dysfunctional. It doesn't calm down. It gets more and more overactive. And then one day, the bladder will tell you, enough, thank you very much, I'm not working. And it fails. Bladder failure is real. They just stop working. A bladder is like a rubber contractor. It's basically like a balloon. In its best balloon, we blow the balloon. It comes out very nicely. When you let go, all the air squeezes out. If you keep torturing that poor bladder, you stretch it more and more and more and more and more. It gets bigger and bigger. But at one point in time, the rubber doesn't want to work. It becomes what I normally call an NTUC plastic bag. You open up an NTUC plastic bag, the shape still remains. The air still remains inside. You don't want that because then you are damned to having a urinary catheter for the rest of your life. For men, big prostate. I don't think we need to go too much into this. This is not a prostate talk, but essentially, I have an operation at 5 o'clock later for a man who cannot remove the catheter. He wants to done it on a Saturday. That's how painful and how discomforting it is to him. You do not want that, okay? People who have BPH or bladder outlet obstruction wakes up many, many times at night, go to the toilet many, many times during the day. Essentially, their life circulates about how many times they go to the toilet, how far they can get to it. That, to me, and your golden years when you should be enjoying life is not a very, very good way to live through. So if you have that problem, you got to get it sorted out. Not to mention the pain that it comes to having a big bladder of 1 to 2 liters, okay? You can imagine this man is perpetually pregnant. How do we then figure out, what do I do when you guys come and see me with this kind of problem? We basically start off by doing a very detailed medical exam history. So we will figure out, or rather I will figure out what causes your urine leakage and in what situations. And then we will talk about your leakage history. And for now, probably at this point in time, we should stop and also thank our sponsor, Depend was outside. And these guys makes very good adult diapers. And the fact of life is that yes, as we age, sometimes we do need to have a bit of adult diapers help occasionally. So one of the biggest component of coming to see me is I'll figure out how much are you leaking. Is it 1 pad worth? Or is it many pads in a day? Or you have diapers like this. I've got one auntie that basically I remember about 5 years ago. She said, boy, I use 1 roll of toilet paper every week. Not too bad, 1 roll. And this auntie folds together 2-3 pieces and fold and put underneath. And he goes through there. Then after that, the doctor came in. Yeah, do you tell doctors you use your toilet paper? Yeah. Not 1 roll, it's 1 whole bag of 10, 1 week. That's auntie's idea of 1 roll. So the doctor came in, wait, that's 10 rolls in a week. And that particular patient had 9 kids. She was in her 90s at that point in time when I met her. She had to go for operation because it was so bad. Cannot leave it alone. Okay? We will also look at your medication history because a lot of medications can cause you to have incontinence as well. All right, and then after that, we will look at naturally a physical examination. And this part of time, we bring in specialized tests because I said to you, there are many, many kinds of urinary incontinence. We need to figure out which one are yours. And we use some of the specialized tests that we employ to go and figure out which category do you belong to and how do we actually investigate and help you with that. So let's go through something about the physical examination. For ladies, one of the things that we will do is basically do a pelvic examination, okay? You might have heard previously before people telling you, friends telling you that things are dropping out, okay? And it's very real, okay? There are many, many things that can happen in the pelvic floor. For the ladies, you can have bladder poking in, you can have rectum poking out, you can have uterus dropping down. So a key component of the examination is to look or even try to make you leak urine in my clinic by making you cough, shifting around, asking you to strain your muscle. And it's very helpful because we can get an idea of how bad is the leak. Obviously, normal people are not supposed to have lah. But if you have 1 drop, 2 drop versus a whole lot of urine come out, it makes a difference and it helps us a lot. And we then know how we can help you. Another thing then we basically do is some of the different tests that I bring in for different people differently. For men, the test is going to be very different from, let's say, a woman. My favorite is to do a frequency void chart. Frequency void chart is actually a very simple record that we do. It's very, very troublesome. 72 hours whereby I ask you to record all the water you take in, all the times you go to the toilet, including the ones at night. And I will basically give you a beaker like this, put inside the toilet. I will want you to measure how much you void. If you have a bit of urgency, I will also ask you to note down. If you have a bit of a leak, I will also ask you to note down. What time you wake up, what time you sleep, I will also note because I want to figure out how many times you actually wake up to go to the toilet at night. Very troublesome, but I assure you, if you work with me and give me a very good void chart, I can find out a lot about details about your condition in a very, very short span of time. Other things that we do if you have overactive bladder is could be potentially a urodynamic study. And this urodynamic study tells me a lot about your bladder contractility condition. Is it squeezing when it should not be? When it's sleeping, when it should be sleeping, is it sleeping? And if it's not, why? Okay, it tells me that not everybody needs to go through it because it can be a bit uncomfortable. Uroflow, all the men will definitely have this. What do? Basically, we get to have lots of water to drink and then go to my toilet and essentially pee into this machine. What they do is they give me a flow rate. And this flow rate is very important because everybody comes to me and tell me, oh, no problem with my urine. Everybody thinks that they are fastest and they were like that when they were 18. Okay, so you say fast, I say slow. We argue a bit. No need to argue. We just measure directly and we can tell a lot of things. At the same time, I make use of the ultrasound to go and figure out how much urine you have left after you pee. So imagine if you basically still have a lot of urine inside after you go to the toilet, right? It tells you you're not actually emptying out your bladder fully. Once we figure out which kind of urinary incontinence you have, we always start treatment. And the first line of treatment that you might be happy to know is almost never medication or surgery. I believe in the most simplest things helps the most people, and they are the one that you're gonna do over and over again. Medications can finish eating, and people for whatever reasons don't come back and fill up the script. But lifestyle medication is very important. We will go through what kind of fluid you take, how often you take them. It's very easy to go to your doctors, or rather doctors will tell you, oh, go and drink more water. How? What time? When can drink? What kind of water? All this we will go through. For example, I tell my patients 2 liters, and don't drink 3 hours before you go and sleep, because then you will end up waking in the middle of the night going to the toilet too. Okay? Things like this I will go through. So it's very important, not just tell you, oh, go and drink more water. How? Caffeine. One of the topmost causes of causing urge incontinence. People come to me with 6, 7, 8 cups of caffeine and don't drink water, and they think that it's normal. Caffeine causes you to have urgency, and you wonder why they chong to the toilet all the time. And that's what you tell them to don't take so much caffeine. On the day she meets me, the following morning immediately improves. Don't need money, man. Someone save you money. You must avoid things that trigger urinary incontinence or things like your straining. If you have constipation, solve the constipation. If you solve the constipation, you don't have to strain your tummy. Don't have to strain your tummy, you won't leak. If you are a smoker, unfortunately, it means that you're coughing a lot. You have to stop the smoking. Things like that, no need money one. Again, if you are a bit on the obese side, I will tell you to honestly say you might have to control a bit of the weight and so on and so forth. So not everything is about medications. For example, hydration, I really do go a bit of that. I even talk about what time do you sleep, what time do you eat. Always remember, eating the last water you drink all the way until you sleep, give it 3 hours, please. Minimum 3 hours. If not, you will be always waking up in the middle of the night to pass urine. Medications do come into play a lot of the time, and unfortunately, it does help, and many times it is needed. For stress urinary incontinence, we can introduce you exercise, or Kegel exercise. Okay, the next slide I'll go through. But for stress, for urge incontinence, we might start you on medications, or even if you have prostate problems, you need to be started on medications to solve the main problem. Otherwise, we are going around in circles. If you have urge incontinence from weak pelvic floor muscles, Kegel exercises is one of those things that ladies have heard a lot. We are told, we always encourage ladies to do a lot of Kegel exercises. It helps to retrain your pelvic floor muscles, which keeps all the bladder and also the bowels in. Okay, so it helps with not just urinary incontinence, it also helps with fecal incontinence. And if you have very mild pelvic organ prolapse, it's also helpful. I don't do this. In fact, I leave it to the expert to do it. In fact, that's why we have a physiotherapist that I work very closely with to teach ladies the right way to do Kegel exercises. Okay, and they will go through a lot and uses very many tools to go and find out whether you are doing it correctly or not. Some of the more common medications for urinary urgency may be familiar to some of you here: solifenacin, oxybutynin. and the trucitor, very, very common medications that we take for urge incontinence or overactive bladder to help relax the bladder and make it a bit more manageable. If you have prostate, lots of medications out there in the market to help increase the flow rate and hopefully decrease the number of times you need to wake up in the middle of the night. And of course, if it does not work, then really we have to talk about surgery. For men, usually prostate is big. You need to talk about surgery to remove some of the prostatic tissue. If you have very bad urgency incontinence, and even after medications, we actually give you Botox. You all know what's Botox, right? Botox, the one that young ladies do. This one is only for more elderly, so they also come for Botox. But we inject it inside the bladder. Okay, and we use the same amount of Botox. In fact, we use probably 10 times more than what the ladies use on the hair. Whether or not you want to take the spare home, I don't know. It always disappear one. And if you have stress incontinence, that is not, remember the old 90-year-old auntie that needed a bit more of help. She needed a slings like that. We really have to reposition the bladder, urethra all the way up, stabilize it. And so she had a very good outcome. And no matter what I do for her, she was very thankful because from 10 rows to even 1 to 2 rows to her is a significant change. And she actually dared to go out of the house. If you have operation for the prostate, you need to have a urinary sphincter put in. There are options as well. So this is a picture of arterial RPN for men. This is actually a doctor's father. Again, you would think that doctor's father usually don't have this kind of problem, but no. In fact, they are the worst. Essentially, what we do is that we cut off some of the tissues that we have, like cut it off and make the whole channel bigger so as to be able to let you pee. This kind of procedure, we don't usually do it on the first time I see you, sorry. You got to try medication first. If it doesn't work, then we'll get there. Because the effects are wonderful. They last around 10 to 15 years. But there are some side effects and not suitable for everybody. Nowadays, there are many, many kinds of ways to remove the prostate tissue, including Resume, which is a steam-based, or Urologist, which is like a curtain. The whole point is to basically make the urine tract bigger so as to let urine come out a lot simpler. So in summary, okay, I'm in the last slide. Urinary incontinence is very, very common in both men and women, and there are a variety of different causes. No one size fits all, no one way of treating one thing that works for everything, okay? It is very likely that people don't tell me openly they have these kind of things, except that we are forced to, except it causes problem, and it's very, very undertreated. It's a real problem, and it can have a lot of impact on your life. It causes the fact that someone don't go overseas, or they go overseas, they are resigned to wearing diapers because the wife tell me, I don't want to wash his pants while I'm on the trip. The smell as well, okay? It can be treated if you have some of this problem. Or at the very least, I can actually hope that help you in managing it. I may not be able to treat everything all the time, but at least we can tell to manage it, at least understand. And with that, hopefully, with all this combination, surgery, medication, and lifestyle, we can actually say goodbye to a problem that might be troubling you for the longest time. With that, I would like to end my talk. I'll be happy for any questions. Thank you very much.